Hello, welcome to Anatomy DAHAR series. I'm Dr. Abdul Hamid. Today's topic is Introduction and Layers of the Pharynx. Free medical education, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. The Pharynx. Introduction. Pharynx in Latin means throat. Let's see the diagram first. This is the sphenoidal air sinus inside the body of the sphenoid bone. Here is the pituitary fossa. Behind the body of the sphenoid is basic occiput. This is flow of the anterior cranial fossa. The whole thing forms the base of the skull. This is anterior arch of first cervical vertebra, the atlas. This is the second cervical vertebra. This is the third, fourth, fifth, and this is the sixth cervical vertebra. Anterior to it, we have cricoid cartilage. The lower border of cricoid cartilage is at the level of the lower border of the sixth cervical vertebra. Now let's talk about the pharynx. The pharynx is a funnel-shaped fibromuscular tube that is made up of fibrous and muscular tissue located in the head and upper part of the neck. The extent, the length and width. Superiorly, the pharynx is attached to the base of the skull. Inferiorly, it extends to the level of the lower border of the cricoid cartilage anteriorly and posteriorly the lower border of the sixth cervical vertebra, where the pharynx continues with the esophagus below. The pharynx is therefore extend from the base of the skull to the level of sixth cervical vertebra, and average length is about 12 to 14 centimeter. The widest upper part is about 3.5 to 5 centimeter, and the lowest part, which is the narrowest part, is where the junction between the pharynx and esophagus is about 1.5 centimeter. Parts of the pharynx. Let's see the diagram first. This is the pharynx, extending from the base of the skull up to the lower margin of the cricoid cartilage. This is nasal cavity, this is oral cavity, and this is laryngeal cavity. Anterior wall of the pharynx has deficiencies, communicates with structures in front. That is, the uppermost part is communicated with the nasal cavity at posterior nasal opening. The middle part of the pharynx is communicated with the oral cavity at the oropharyngeal isthmus, and the lowest part of the pharynx is communicated with the laryngeal cavity at the inlet of the larynx. On account of these three communications, therefore, the pharynx is divided into three parts. The part behind the nose is called nasopharynx. The part behind the oral cavity is called oral pharynx. And the part behind the opening of the larynx is called laryngopharynx. This one, nasopharynx, is the highest one, also called epipharynx. The laryngopharynx is the lowest part, is called hypopharynx. Therefore, the pharynx is located behind the nose, behind the mouth, and behind the larynx respectively. It is anterior to the upper six cervical vertebrae, vertebral muscles, and prevertebral fascia. Functions of the pharynx. Let's see the diagram first. This is the nasal cavity, nasopharynx. This is the oral cavity. This is the oropharynx. This is the laryngeal opening. This is the laryngopharynx. This is the trachea. And this is the esophagus. Look at the color of the arrow. The green color, which is for respiratory. This is the one coming through the nose, coming through the nasopharynx, coming through the oropharynx and enter into the windpipe here. The purple color arrow will go through the oral cavity, through the oropharynx and enter into the laryngopharynx and then go down into the esophagus. Therefore, pharynx is the passage of dual system. Nasopharyngeal part is purely respiratory tube. See, only green color is there. Oropharyngeal part is shared by both respiratory and alimentary system. This oropharyngeal part, you can see two colors of arrows there. For respiratory and for alimentary, the food will be going through here. Laryngopharyngeal part is purely alimentary here, just purely for passing down the food into the esophagus. They have a direct connection between each other through the pharynx. It's a photo of direct connection between the naso and oropharynx. Photo by Mark Rashid, South China Morning Post, 30th January 2003. It's a rare sight, threading a live snake up the nose and out the mouth, proving a direct communication between the nasopharynx and oropharynx. If it enters the laryngopharynx and the larynx or esophagus, what may happen? Let's see the sphenoid bone. It is seen from behind, that is posterior view. Let's see the parts of the sphenoid bone. This is the body of the sphenoid bone. These two are lesser wings of the sphenoid bones. These two are the greater wings of the sphenoid bone. This is lateral pterygoid plate. And this is medial pterygoid plate. We are looking the medial pterygoid plate. This is the posterior sharp margin of the medial pterygoid plate. It ends below as hemulus of the medial pterygoid plate. I give three asterisks, this one and this one, sharp margin here. They are going to be recalled. Skeleton of left medial surface of the head. I'm explaining to you the diagram here. We are looking the left half of the skeleton of the skull, but we are looking from inside. So this is medial surface of the left half of the skeleton of the head. So this is left medial pterygoid plate. This is posterior sharp margin of the left medial pterygoid plate, and this is the hemulus of the left medial pterygoid plate. This is styloid process. This is left half of the hyoid bone with lesser horn and greater horn. This is medial surface of the mandible. How would you know? On the medial surface, we have the mylohyoid line is there. Now, between the hemulus of the pterygoid plate and the mandible, we have raphe, called pterygomandibular raphe. What is the meaning of raphe? Raphe means general term for the line of union of the halves of various symmetrical parts. To make it simple, actually anterior to the raphe there's one muscle is there. Posterior, there's another muscle is there. Fibers of these two muscles will meet here along this one we call raphe. So now this is the pterygomandibular raphe. Base of the skull. We are looking the base of the skull from below. Let's identify few important structures. Number one, foramen magnum, the biggest foramen. On each side and slightly in front is occipital condyle. It will articulate with the first cervical vertebra, the atlas. In front of it is we have a canal called carotid canal. Okay. Anterior to that is petrous part of the temporal bone. Temporal bone has many parts. This is called petrous part of the temporal bone. And next is pharyngeal tubercles, which is anterior to the foramen magnum. And this is two pterygoid plates. This is the medial one, this is the lateral one. This is the posterior sharp margins of the medial pterygoid plates. If you come down here, this is the hamulus of the medial pterygoid plate. This is the very schematic diagrams of pharyngeal muscles and pharyngobasilar fascia. As I have stated earlier, the pharynx is the fibromuscular tubes made up of fibrous tissue and muscles, and also I stated that anterior part of the pharynx is deficient and directly related to the nasal cavity, to the oral cavity, and to the laryngeal cavity anteriorly. Right. Now if you see here, these muscles are, this is the inferior constrictor muscles, this is middle constrictor muscle, this is superior constrictor muscle, and this is pharyngobasilar fascia, like stack of cups, one on another one, and then this another one, and on top of this we have the pharyngobasilar fascia. These are all constrictor muscles. Now pharyngobasilar fascia, the same diagram. This is, we are looking from in front, we are now looking from behind. You can see raphe here, green color. This is the pharyngeal tubercle at the base of the skull. So at the top is the last cup is our pharyngobasilar fascia, which is attached to the base of the skull. We are going to discuss this one now. Okay. Attachment of pharyngobasilar fascia to base of the skull. This is the base of the skull. We have already discussed about the structures at the base of the skull where the pharyngobasilar fascia is attached. I hope you still remember. This is the number one is pharyngeal tubercle. This is the petrous part of the temporal bone. This is the uppermost part of the posterior margins of the medial pterygoid plate. Finally, come down to the lowest end is the hamulus. So shall we start the attachments of the pharyngobasilar fascia to the base of the skull? Number one, it is attached to the pharyngeal tubercle here. Then after that, each side it goes laterally. Number two, and then crosses over the petrous part of the temporal bone. Number three, and goes forwards. When it reaches around the uppermost part of the medial pterygoid plate, there is cartilaginous part of the auditory tube is here. So this fascia will be attached to the cartilaginous part of the auditory tube and then attached to the posterior sharp margins of the medial pterygoid plate, coming down, and finally reach to the lowest end of the medial pterygoid plate, that is the hamulus. So this pharyngobasilar fascia is on the lateral side and posteriorly, but anteriorly it is open. Continuation of the attachments of the pharyngo-basilar fascia to the base of the skull. If you see the diagram very carefully, pharyngo-basilar fascia sweeps around from the posterior sharp margins of the medial pterygoid to the posterior sharp margins of another medial pterygoid. It holds the nasopharynx permanently open in front for breathing. It extends inferiorly and diminishes the thickness below the level of the hard palate. That means pharyngo-basilar fascia is superiorly attached to the base of the skull. Inferiorly, it reaches up to the level of the hard palate where it fades away. Okay. Next is quadrangular area of the apex of the petrous temporal bone. This is the one we have already mentioned there. It lies, if you see here, pharyngo-basilar fascia is here. This area is now within the lateral recess of the pharynx. So this little recess here is called sinus of Morgani of the nasopharynx. The levator palatine muscle arises here. So this is the attachment of one muscle, levator palatine muscle. It arises here. So this muscle is intrapharyngeal, so inside the pharynx. The muscle is inside the upper part of the pharynx. The cartilaginous part of the auditory tube, which will be around here, enters the nasopharynx above the pharyngo-basilar fascia. Introduction to the pharyngeal muscles. We are looking the right pharyngeal muscles from the right side, from the outside. This is anterior. Pharyngeal muscles, they are arranged in two layers, outer layer and the inner layer. The outer layer muscle comprises of three pairs of circular muscles called constrictors muscles. They are superior constrictor, middle constrictor, and inferior constrictor. Inferior constrictor is again divided into two. The upper one is thyropharyngeus part of the inferior constrictor because it comes from the thyroid cartilage. The lower one is called cricopharyngeus part of the inferior constrictor because coming from the cricoid cartilage. These muscles, constrictor muscles, are arranged like three flower pots stacked one on another. Raphe in Greek means line of union of the halves of various symmetrical parts. Plural means raphe. So I've already mentioned this one earlier. B. The inner layer comprises a total of three pairs of longitudinal muscles, three on each side, called elevators muscles. Let's see the diagram first. We are looking the right longitudinal pharyngeal muscles looking from behind. This is base of the skull. This is styloid process. This is auditory tube. This is palate, soft palate. And here is the pharyngeal part. Okay, let's talk about three muscles. The first one is palatopharyngeus muscles coming from the soft palate to the pharyngeal region. Number two is stylopharyngeus muscles coming from the styloid process to the pharyngeal region. And three, salpingopharyngeus muscles, salping in Greek means trumpet, coming from the auditory tube to the pharyngeal region. They are located deep to the outer constrictor muscles. Longitudinal muscles, they are inner group of pharyngeal muscles. We have two diagrams here. This is lateral wall looking from inside, medial view. This is lateral wall looking from outside, lateral view. Okay, let's see the structures here. This is auditory tube. This is soft palate. And this is the pharyngeal region. In this diagram, here is the soft palate. And here is the styloid process. This is the pharyngeal region. So, in a group of muscles, 3 longitudinal pharyngeal muscles are: number 1, palatopharyngeus, coming from the soft palate to the pharynx, coming from the soft palate to the pharynx. Number 2, stylopharyngeus, coming from the styloid process to the pharynx. And the third one is salpingopharyngeus, coming from the auditory tube to the pharynx. There are 3 inner groups of muscle, longitudinal pharyngeal muscles. Layers of the pharynx. Let's go through the diagram first. This is posterior view of the sphenoid bone, body of the sphenoid. Here is the pharyngeal tubercle. This is posterior sharp margins of the medial pterygoid plate. Okay, this is the lowest end of the medial pterygoid. This is the humulus. This upper part here is the auditory tube. This is superior constrictor, middle constrictor, inferior constrictor, which consists of 2 parts, thyropharyngeal part and cricopharyngeal part. Here is the wall of the esophagus. Let's see the layers of the pharynx from inside to outside. The first layer, mucosal layer. This orange color is the mucosal layer. In nasopharynx, it is continuous with the nasal cavity and pharyngotympanic tube. Because of that, in the nasopharynx, the mucosal layer is respiratory epithelium, which is pseudo-stratified columnar epithelium with goblet cells. However, this mucosal layer in the oral pharynx, which is continuous with the oral cavity, together with the laryngopharynx, they are lined by stratified squamous non-keratinized epithelium. Both parts are passed through by the foot. That means you can see the foot will be going through around the oropharynx and laryngopharynx. We have already mentioned about that one. Now, lateral to the mucosal layer, outside the mucosal layer is the second layer. That is the submucosal layer. In the nasopharynx and oropharynx, this submucosal layer contains lymphoid aggregations. That is, they are part of the Waldear's lymphatic ring. We are going to discuss in another chapter here. Continuations of the layers of the wall of the pharynx. After the first layers, most inside, second layer, then outside the second layer, we have the third layer. That is the pharyngo-basilar fascia. We have already discussed this one in detail. It's coming from the base of the skull, coming down along the posterior sharp margins of the medial pterygoid plate and extend down up to the level of the hard palate where it fades away. Right? Now, next layer is the fourth layer, which is pharyngeal muscles. They are in 2 groups. We have already mentioned that. The first group, the deeper one, is the longitudinal pharyngeal muscles, 3 pairs. And then outside the longitudinal pharyngeal muscles is the circular pharyngeal muscle, that is the constrictor muscle. They are also 3 pairs. This is superior, this is middle, and this is inferior constrictor muscle. This is thyropharyngeus part, and this is cricopharyngeus part. And this is the esophagus. Now, outside the fourth layer, that is the muscles layer, next to that is the buccopharyngeal fascia, fifth layer, outermost layer. Let's see the diagram first. This is medial pterygoid plate. This is the mandible. We have already mentioned that between the hamulus and mandible, we have pterygomandibular raphe. We have mentioned that. What is the raphe? Two muscle fibers will meet there. Yes, in front of it is buccinator muscles. Behind it is superior constrictor muscles of the pharynx. Okay, here. Between this, we have the raphe is there. In front, buccinator. Behind is the pharyngeal muscle. So both muscles are laterally covered by fascia. That is called buccopharyngeal fascia. This is the one covering here. So if you see in this diagram, outside the constrictor muscles will be the buccopharyngeal fascia is there. Okay, it is anteriorly covering the buccinator, posteriorly covering the superior constrictor muscle. Between the circular, that is the constrictor muscles, and buccopharyngeal fascia, we have plexus of pharyngeal veins and plexus of pharyngeal nerve. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.